14 years ago, when I became CEO, there was plenty of work to do, plenty of things to be done. But I've always been one that believes that a company exists within a larger ecosystem in the world. And maybe it was my being an Eagle Scout. I learned early on the notion that when you do a campsite and create a campsite, and just camp out overnight, you leave your campsite better than you found it. And I think any enterprise, whether it be a nonprofit, for-profit, business, whatever, is always at its best when it is thinking not just about its own survival, not just about its own success, or the success of the people inside the organization. It's about, do we actually make a permanent, even if small, but a permanent difference in the fabric of the society in which the organization exists. The journey in healthcare for people, whether they're well or they're sick, often is laced with anxiety. And what they often, the last thing they need in, whether it's the individual or their family member that loves them, is to be presented with a control mindset that says, we're going to tell you what's good for you. Here's the treatment protocol, get on the roller coaster and go. Without ever stopping and saying, wait a minute, how do you want to go through this? What are your own personal values? What's important to you? Healthcare focuses way too much on what's the matter with you, as opposed to starting with what matters to you. And how can we help you on your journey in the way that is most meaningful for you? Because research tells us that people who feel a sense of self-control, of being able to navigate, do better. They're happier. So our cause is I guess, pretty bold and involves quite fundamental changes to the way things are today. But we believe that that's what it's not only that we have the opportunity to do it, we believe that's what we must do if we are being true to the generations of leaders who handed this company off, and very true to the people that founded the company.